call it the Great Resignation. Doctors and other healthcare workers are leaving their jobs in droves. In 2021, more than 300,000 left the medical profession, and more than one-third were doctors. On this week's episode of The Global Lane, Dr. Stephen Soloway explains why nearly half of all American healthcare providers now say they'll quit by 2025.
Things have been spiraling in the last 2 to 4 years. I can't explain the 2 to 4 year escalation. However, I can tell you at this point in time, doctors hate medicine. It used to be so enjoyable. You'd learn, you'd have relationships with patients, you'd get them better, or you would try to. You'd rely on your colleagues for advice. Everything was nirvana. It was perfect. Right now, Medicare has cut physician fees for office visits, for 17 years in a row, while expenses go up. The government, by pushing their woke agenda, is incentivizing staff that don't make a lot of money to sit home and collect and not work. So when my office and the hospital and the other hospital and the other hospital have thousands and thousands of unfilled jobs for medical assistants, for clerical work, for record takers, for all of the jobs that are not directly related to medicine, we have a big shortage. While we're dealing with the shortage, we're noticing that the government is coming into our practice at night on the computer that they mandated 15 years ago with the Obamacare. And we are being criminalized just like the Department of Justice is a criminal weapon used by the left. The medical establishment has become a criminal wing to investigate people that are working too much because, God forbid, you should do a good job efficiently. You're not considered to be a helper. You're considered to be a threat to the government, as all conservatives are a threat to the government, and all self-employed people are a threat to the government. And for this reason, I can't speak for every doctor, but one thing beautiful about medicine is the autonomy. Well, the autonomy is gone. And without autonomy and freedom and the ability to think outside the box, why would you want to go into a profession which you're supposed to think outside the box to come up with answers to unanswerable questions? You know, we're not dealing with math questions where 2 + 2 is 4. We're dealing with somebody with a headache, rash, and a fever and joint pain, and we have to sift through data, which we have to order the right data. And if we don't have somebody to input the data, the test won't get done. If the person at the lab isn't there to draw the blood because they hate their job and they were given $1,000 by the government to stay home, then we're not going to get the test. If the MRI tech doesn't want to work because they don't like their salary, well, you're not going to get the MRI. And by the way, if you do get these tests approved, you're going to find out that the insurance company puts up a firewall and it's not approved. It's not approved because they don't want to pay for it.
What can the average person do about all this then?
The only thing that anyone can do about this is there has to be almost a revolution. And it's a two-phased attack here. One is you got to educate yourself and you got to advocate for yourself. You need to know the CEO of the hospital. You need to know the nursing manager. You need to know the congressman. And when you have problems, you really have to speak up, because if you're in the right, they can't deny you. And the people don't understand that these companies don't have the right, and the government does not have the right to deny you any reasonable care, whether it is a test or a medication. And changing drugs for the benefit of their financial bottom line and the shareholders and the company, this is all a bunch of bull. So that's one thing. The second thing is that doctors have to be a little bit united in the sense that, and I see this happening now, doctors are not accepting Medicare patients. They're not accepting Medicare assignment. So the patient has to pay the $500 up front. Then they submit the bill to Medicare and they get back to $17, and they see why the doctor didn't want to deal with it. So doctors need to take less insurance. They need to take less orders from anybody. And at the same time, the patient needs to be educated and know who to fight for. Who to yell to fight for them. Because the doctor, I cannot fight for 20 people a day by myself, nor am I going to be able to pay for literally a multidisciplinary team to do the fighting for me. Now, that's what needs to be done. So the only way it can be done in a cost-effective manner is me see less insurances and me fight more and educate my patients more. That's what can be done.
Okay, the book is Medical Politics: How to Protect Yourself from Bad Doctors, Insurance Companies, and Big Government. Dr. Stephen Soloway, thank you for joining us. We appreciate it.
I loved it. Thank you so much. I can't wait to come to Virginia Beach.
Also tonight on the Global Lane, why the possible indictment of Donald Trump may have hit a dead end. And China and Russia are strengthening their alliance. Is a big war coming? You can see this on the Global Lane tonight on the CBN News Channel at 8:30 Eastern or on the CBN News app and on YouTube.